I'm Morgan Harris. I'm a nursing student. Today I'm going to be doing a full physical exam on a healthy 19-year-old male. The history has been completed previously, as have the vitals been collected. So we're going to go ahead and start the exam. Hands are washed. Okay, so first I'm just going to look at the patient's face and head, looking for symmetry, any abnormalities. Right, I'm just going to touch your hair here. Look at hair distribution. I'm just going to feel your scalp, okay? Good. Okay. Can I have you open your mouth for me? Good. Stick out your tongue. Wave it side to side. Good. Can you open and close your mouth? Good. And clench your teeth. Good. Smile for me. Puff up your cheeks. Good. Stick your lips out like a fish. Good. Can you wrinkle your forehead? Good. And then squeeze your eyes tight, really shut tight, and don't let me open them. Good. Okay. Now I'm going to test sensation on your face. So this is going to be the sharp, and this is going to be the dull. Can you feel the difference between those two? Okay, so I'm going to have you shut your eyes. I'm going to touch various portions of your face, and then I want you to point to where I touched and tell me if I touched you with the sharp or the dull edge.
Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Good. Okay, now I'm going to take a look at your eyes. Right. So again, looking for symmetry, looking at the lids. All right, I'm just going to pull the bottom of your eyes down a little bit. Good. All right. Okay, so really quick, I'm going to check your pupils. So I'm going to shine this light in your eye. Okay, I want you to just look straight ahead at that wall behind me, okay? Good. I'm going to do the same thing, but I'm going to be looking at this eye. See if it moves, closes with this one. Good. I'm going to do the other eye. Awesome. Great. Okay. Now, I want you to just look at my finger and just keep your eyes on my finger as I bring it closer to your face. Good. Okay. Now I want to check your ability to look in different areas. I just want you to follow the tip of my finger, and I'm going to watch your eyes and let me know if you have any pain looking in any direction, okay? Keep your head still. Good. No discomfort with that? Okay, good. Now, I don't have a Snellen chart, so I'm going to do a makeshift visual acuity test. So I just want you to cover your right eye and read the letters on this sheet.
Bottom row.
Bottom row, yep.
BWLKNC.
Great. And then can you switch eyes? Do the same thing.
BWLKNC.
Great. Okay. Now I'm going to check your peripheral vision. So what I'm going to do, I want you to close your right eye. Close your right eye. Good. Awesome. Okay. And I'm going to close my left eye. Okay. I want you to tell me how many fingers I'm holding up.
1 and 2.
Good. Can you switch? Good. I'm going to close this eye so we have the same peripheral vision. Okay.
2, 4.
Awesome. Great job. Okay. So normally at this point I would look at his nose. So I'm going to inspect his nose, look for symmetry. I do not have a speculum, but normally I would look into his nose, and I'm going to look at the mucous membranes, make sure they're not inflamed or discolored. Okay, I'm just going to touch your nose here, palpate this. Everything good? Okay, and do you have any pain when I touch here?
No.
Any pain up here?
No.
No? Okay. Can you breathe out of this nostril when I do this?
Mm-hmm.
Good. Can you breathe out of that nostril?
Yep.
Great. Awesome. Okay, so now I'm going to look in your mouth. I just want you to open your mouth and say ah, okay? Stick out your tongue. Ah. Good. Ideally, I would have a tongue depressor for this, but I do not have one handy. Okay. At this point, I would also do an ear exam. I do not have an otoscope, so I will just discuss it. I would be inside the ear, I would be looking for a shiny gray tympanic membrane, as well as the triangular light reflex in the tympanic membrane. Okay, I'm just gonna palpate that outside of your ears. Do you have any pain with this?
No.
Any pain when I press here?
No.
No? Okay, good. And what about when I press on this bone back here?
No.
No? Okay, awesome. Do the same thing over here. Any pain with any of this?
No.
Okay. Pain there?
No.
Awesome. Okay, so I want you to shut your eyes and let me know. Can you hear this?
Mhm.
Okay. Does it sound the same over here?
Mhm.
Okay, good. All right, you can open your eyes. I'm gonna occlude that ear and I'm gonna whisper over here, and I want you to tell me what the word that I whispered, okay?
Caterpillar.
Okay, awesome.
Daisy.
Awesome. Okay, so I do not have a tuning fork, but normally at this point I would also do both a Rhine and a Weber test. So for the Weber test, I would place the tuning fork in the middle of his forehead, and I would want him to hear it the same on both ears. For the Weber test, I would be placing the Rhine test, I'd place the vibrating tuning fork on his mastoid process. He would let me know when it would stop vibrating, and then I would put it in front of here. That's testing air conduction versus bone conduction, and air conduction should be greater than bone conduction in a normal scenario. Also, when I was doing the eyes, if I had an ophthalmoscope, I would have been looking for the red reflex and looking at the structures in the back of his eye. I would want the cone of light reflex, and I would also look at the macula. Okay, now I'm going to look at your neck. All right, just looking for symmetry. Awesome. Just gonna palpate here a little bit. Good, trachea's midline. Awesome. All right, can you turn your head that way for me? Just gonna feel some lymph nodes here. Okay, look that way. Good. Any pain with any of that?
No.
Okay, good. So what I'm gonna have you do, I'm gonna check your thyroid. So can you just take a sip of this water and hold it? Don't swallow until I tell you to. Okay, good. Okay, go ahead and swallow. Good. All right, I'm gonna check a couple more areas of lymph nodes, okay? Preauricular lymph nodes. You just tell me if you have any pain or tenderness. Okay. Good. Submandibular. Submental. Already checked those in your neck. Okay, can you shrug your shoulders for me? Okay. Good. Any pain in there? Awesome. Okay, now I'm going to inspect your chest. Right? Everything looks good. I don't see any palpitations, any scarring, abnormalities. All right, I'm just gonna palpate. You let me know if you have any pain anywhere. No pain with any of that? Okay. I'm just gonna feel your heart rate over here really quick. Awesome. Okay. Now I'm just gonna tap on your chest, and I'm just gonna listen to the noises that I hear, okay? Good. Okay, I'm gonna do it one more time up here. I'm listening to where the sound changes for your liver. Okay, awesome. Thank you. All right, now I'm gonna listen to your heart. You just go ahead and relax. You can breathe normally. Good. Good. I'm going to listen to all those same spots over again, just with the back of my stethoscope, okay? Good. Wonderful. Okay. Now I'm going to listen to your lung sound. So every time I put my stethoscope on your chest, I want you to take a big breath in and out. If you feel lightheaded or need a break at any point, just let me know, okay? So in through your mouth, out through your mouth. Doing okay?
Mm-hmm.
Now, what I want you to do for me is every time I put my hand on your chest, I want you to say 99. Okay?
99. 99. 99. 99. 99. 99. 99. 99. 99.
Great. Okay. If I could just have you swing your legs this way for the video. I'm going to do a lot of the same things on your back. And so first I'm just going to start inspection, okay? No lumps or bumps or any obvious scarring or asymmetries. All right, I'm going to palpate down your back a little bit. You just let me know if you have any pain. No pain with any of that?
Nope.
Okay, wonderful. All right, so what I'm going to have you do now, I'm going to put my hands right here around your body, and I want you to take in a big breath. And out. Good. Okay, and one more time. Awesome. So there I was just checking to make sure that your lungs are both expanding equally. All right, now I'm going to listen to your lung sounds again. So same as before, I want you to take a big breath every time you feel my stethoscope, okay? One more big breath. Great. Okay, I'm going to have you do the same thing as before. Every time you feel my hand on your back, I'm going to have you say the word 99, okay?
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so I'm going to put my hand flat on your back, and I'm going to hit my own hand, okay? And I'm checking for any CDA tenderness or pain around your kidney area, okay? Let me know if you have any discomfort or pain with this. Any pain? Okay. That was okay? Okay. Awesome. All right. If you don't mind, could you go ahead and have us lay down on the couch right there on your back? Yep. Perfect. All right, so I'm gonna just listen to your heart again, laying down, and also take a look at your neck, okay? All right, so again, looking at your chest. Awesome. I'm gonna palpate it again. Okay, I'm gonna feel your heart right here for a second. Awesome. You can just continue to breathe normally while I listen to your heart. Great, okay. Same thing, but just listen with the other side, okay? Awesome. Okay, I'm just gonna take a look at your neck really quick. Just looking, see if all those veins and everything look normal in there. Okay. Good, okay. Just gonna feel your neck here. Awesome. Okay. So now I'm gonna listen to the artery in your neck. I'm gonna have you hold your breath while I do that, okay? So go ahead and take a breath from me and hold it. Okay, go ahead and breathe. And then let me know when you're ready and we'll do the other side. You're okay?
Mm-hmm.
Okay, big breath and hold it. Awesome. Thank you. Okay. Now I'm going to take a look at your belly, okay? Looking at the color, the contour. Okay, you're not distended or anything, which is awesome. All right. And I'm going to listen to your belly, tap it, and palpate it, okay? Okay, awesome. All right, I'm going to listen to a couple other spots with the other side, okay? You just keep relaxing. Good. I'm not going to do it here, but I would also normally palpate and auscultate the femoral pulses on each side. Okie dokie. Now I'm just going to tap on your belly a little bit, okay? Awesome. I'm gonna lightly touch your belly. You let me know if you have any pain or discomfort, okay? No discomfort with that? Okay. I'm gonna do the same thing, but a little deeper. No pain with any of that? Okay. I'm gonna have you take, I'm just gonna feel for your liver now. So I'm gonna have you take a big breath and then breathe out, okay? Okay. Sorry, I know that's a little uncomfortable. Okay, now I'm just gonna feel your spleen over here. So I'm gonna push up from down here. Good. Just making sure all your organs are properly sized. Okay, now if you want to return to the chair, that'd be wonderful. Okay, now I'm just going to do various tests on your arms, your legs, and some neuro things, okay? So first, can you raise your hands over your head for me? Good. Okay, you can put them down. And can you actually go like this? And I want you to, don't let me push your arms down. Okay, awesome. Now I want you to go like this. Good. Okay, don't let me pull your arms towards me. Good. And now don't let me push them towards you. Awesome. Okay, can you go like this with your fingers? Good. Don't let me pull your fingers in. Good. Okay, now can you, good. Don't let me pull them apart. Awesome. Can you squeeze my fingers as hard as you can? Good. Great. Just going to take this time to feel your pulses here really quick. Good. All right. So I'm going to do the same thing on your arms that I did on your face earlier. So I'm just going to remind you, this is sharp, this is dull. Okay? So shut your eyes and let me know.
Sure. Dull. Dull. Sure.
Okay.
Sure. Dull. Sure. Sure.
Good. So normally I would use a tuning fork to test his vibration sense on his hand here and on his foot. So I obviously can't do that. I might also check hot and cold sensation. Okay, so can you just put your feet out here for me? I'm just gonna feel your pulses in the back of your knee. Good. I would also use this time to check for deep tendon reflex. I would do the triceps reflex, biceps reflex, and the patellar tendon reflex if I had a reflex hammer, which I don't. All right, just going to feel your pulses down here. Good. Good. All right, normally at this time I would wash my hands after touching the patient's feet. Okay, so can you lift this right leg up off the chair? Good. And don't let me push it down. Good. Now do the same thing. Lift it up. Don't let me push it down. Awesome. Okay, put both feet out, like kick up. Good. Don't let me push them down. Good. Now pull them in towards you. Don't let me pull them out. Good. Okay. And with your wrist, can you go like this? Okay. Don't let me pull them down. Good. Now don't let me put them back. Awesome. Okay. Same thing with your foot. I want you to press down like a gas pedal. Good.
Oh.
Do this one. Good. And now pull up against me. Good. Okay. And can I see your fingers really quick? I'm just going to look at your capillary reflex. Refill. Good. Do the same thing down here. Okay, I'm gonna check the sensation on your legs. Same thing, okay? You don't have to point this time. Just let me know if it's sharp or dull, okay?
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Awesome. Okay, and I'm going to have you do a couple more things. Can you go like this on your legs as fast as possible? Flip your hands. Good. Okay, now I want you to take this heel of this foot and put it towards your knee and run it down your shin. Good, and then can you do the same thing with the other leg? Awesome. Okay, now I want you to take your right hand and touch your nose, and then touch my finger, and then back to your nose with this hand. It's okay. Okay, good. Back to your nose, to my finger. Back to your nose. Good. Good. Okay, other hand. Try and keep your head still. Good. Good. Okay, now shut your eyes, and I want you to, well, you can keep them open for now. I want you to go like this with your eyes shut as fast as possible, okay? To your nose and away, okay? Okay, you have to go that fast. Okay, same thing with the other hand. Okay, eyes shut to and from your nose. Awesome. Okay, now I'm going to ask you to stand up, okay? And face this way for me, okay? Again, I'm just looking at your back, okay? And if you can, I want you to bend down and touch your toes and kind of just let yourself hang, okay? And just let your arms hang, okay? Good. So I'm just making sure your spine is even. Awesome. Good. Okay. 1 second, just get your shoulder height. Awesome. And can you shrug your shoulders for me? Good. Don't let me push them down. Awesome. Okay. And one more thing. Can you please look to that way for me? Good. And look back this way. Awesome. Can you look up? Good. Look down. Great. And then can you tilt your head to the side like that? Good. And to the other side. All right. So I'm going to have you do those same things, except you're going to push against me, okay? So try and turn your head against my hand. Good. Same thing. Good. Okay, now tilt your head. Good. Good. Chin down. Good. And try and pull up against my hand. Good. Awesome. Okay, now I want you to hold your hands out like this. Okay, good. And I want you to close your eyes and stand there and balance and hold your hands there. Awesome. Okay, you can go ahead and put your arms down. All right, now I'm just gonna look at your gait. So if you could step over here. Perfect. Just walk there, normal, to the wall, just how you normally walk. Awesome. And come on back. Great. And could you do the same thing on your toes? Walk on your toes. Perfect. And then on the way back, can you walk on your heels? Great. And then walk like you're walking on a tightrope. So foot to heel to toe. Wonderful. That's awesome. Okay, and you are all set. That is the end of your physical exam. Everything looks good. Thank you very much.